Great. So I have 3 o'clock. So welcome everyone to Pathways to Justice, Inclusive Practices Shaping the Kansas Heartland. Before we jump in, we have just a few housekeeping items to go over. Audio is available on your computer or by phone. We kindly ask that you please keep yourself on mute to avoid any background noise, but we do encourage you to keep your cameras on so we can see your faces throughout the session. Feel free to drop your questions into the chat box and we will do our best to respond as we go. There will be time for Q&A following the presentation. If you have any technical questions, please send a message in the chat to Nolan Gill or Jennifer Harmon, who will be our tech support for this session. Thank you, Nolan and Jennifer, for keeping us moving. All sessions are being recorded and will be available on the Train Learning Network in the coming weeks. Once the recordings are live, all registered participants will receive an email with the details. We are so excited to introduce Jade Ramsdell, the Performance Improvement Director at the Kansas Department of Health and Environment, where she leads state health initiatives focused on quality improvement and health equity. With over 9 years of experience, she's addressed workforce challenges and resource constraints in rural and diverse communities, while also owning a public health strategy consulting business that supports organizations in developing effective health strategies. Jade's full bio is available in the resources section on the conference page. By the end of the session, you should be able to describe the quality improvement and performance management framework used by the Kansas State Health Department to enhance equitable and inclusive practices, identify key past experiences and current practices of the department in addressing community health needs using specific examples, outline the future goals of the Kansas State Health Department focused on justice-centered practices and how they align with community needs, and evaluate the strategies the department employs to navigate dynamic environments and adapt to external challenges, providing concrete examples. So as you listen to this presentation, we encourage you to reflect on your position in the equity continuum. Are you blooming, affirming, or transforming? Identify your organization's framework or sunflower cycle that gives your transformation from a tiny seed into a tall, vibrant flower. So with that, I will now turn it over to Jade to get us started.
Thank you, and so happy to be here with you all today. I will go ahead and have you go to the next slide. You've done a really great job of doing an overview of what we're going to be learning today, so you can carry on to the next one as well. And I'm going to take a moment to just tell you a little bit about myself. As the Performance Improvement Director here at the department, we've been through a lot when it comes to our equity journey in this continuum. I always give a disclaimer when I start presentations like this that I am currently standing, and at one point you might see me sink down into my seat, and that's because I can no longer stand as long as I have. It just depends that day, so don't be alarmed if you see me kind of floating down a little bit. But let's get into it. In Kansas, our journey towards health equity really reflects the resilience of our state flower. We talked a little bit about the sunflower just before this presentation started, but that's something to keep in mind here. At the Kansas Department of Health and Environment, health equity really guides our efforts, ensuring fair access for all, especially post-pandemic. With 85% of our state being rural or frontier, we're adapting healthcare, workforce, housing, and social services to meet the needs of aging and in our increasingly diverse populations, which at times can be surprising to folks. Like the sunflower, Kansas continues to thrive and overcome challenges. Next slide. So one thing you're seeing here is an excerpt from our Kansas legislation. And in this excerpt, it states, "The sunflower symbolizes our rich past, our present, pride, and golden future." This is important because, like the sunflower's resilience, our work in public health and equity ensures all Kansans, regardless of location or background, have access to the care and opportunities they need to thrive. Now, I've given this presentation several times. But for the first time, I'm giving it to you like this, because as we journey along together and we talk about this equity continuum, I also want you to get a little bit of a depiction of what it looks like here for us, and why we have so much pride in the work that we do, and how that really serves as a catalyst for our work here at KDHE. Next slide. So with our shifting demographics, Kansas is seeing a rising demand for senior care and culturally responsive services. Like the sunflower, which adapts to its environment, our state must adjust healthcare and social services to meet these evolving needs. By embedding health equity from the start, we ensure that communities can thrive even in the face of change, which we've seen a lot of it here at the department, especially post-pandemic. From the start, I emphasize this because it will later be relevant, so hold on to this whole idea of the shifting cycle of the sunflower. Next slide. So during the COVID-19 pandemic, Kansas utilized, like many other states, the OT 21-2103 COVID-19 Disparities Grant to tackle health inequities. Geographic isolation in rural areas limited access to information and services, while historical mistrust, which we all have heard a lot about, in minority communities and rural communities hindered vital communication and preventative measures. Moreover, delays in grant approval created challenges for high-risk populations in accessing the vaccinations. And despite these obstacles, KDHE remained committed to advancing health equity throughout the pandemic any way that we could. Next slide. And this all started somewhere I'm very proud to be able to speak about, which is the Center for Performance Management here at the department. Now, this was formed in 2021 when I was hired, and was strategically placed within our Office of the Secretary to enhance service effectiveness within the health department. By adopting a root cause problem-solving method, our CPM team fosters collaboration and innovation, ensuring our efforts not only align with our mission, but really help to cultivate health equity in our state. We conducted over 12 staff interviews, 1 formal assessment, and 3 data review sessions to inform our approach and drive continuous improvement, which really served as the catalyst for the change that we needed at the time. What does that mean? Essentially, coming into the department, this didn't exist before. So in order to build something that could be sustainable, that folks can really look to for technical assistance and guidance surrounding this equity continuum work, we really needed to make sure that our foundation was firm. And we really needed to hear from people at the department about what that journey had looked like prior to me entering, prior to our center developing. And we used that to inform a lot of our decision making. Next slide. Now for us, I spoke about the disparities grant. Grant funding really serves as a foundational building block and a seed for growth. And while it's easy to rely on it heavily, it's always important to consider, as I'm sure many of you do on this call, what comes next after the large sum of funding comes in and you're looking at those deliverables, so on and so forth. And this funding for us has provided essential support for program and infrastructure development, kickstarting a lot of innovative initiatives and enhancing our workforce capacity, and fostering strategic partnerships for community engagement. All in all, by aligning resources with diverse initiatives, we focused on comprehensive strategies that have prioritized sustainability especially, and address the needs of our diverse populations. Our approach included expanding mitigation and prevention resources, improving data collection, building infrastructure and support, mobilizing community health workers, you name it. But together, these efforts laid the groundwork for long-term growth and thriving community. And I think it's important to acknowledge what the roots are and where it came from. Next slide. Now, I would be remiss if I don't do a special shout out to the wonderful team that has formed as a result of this catalytic funding for us. This is the Center for Performance Management team. We've got folks working in many different areas to be able to support our needs here across the state. I want to just give a special shout out to them and show their faces. And you'll learn a little bit more about what these roles distinctly mean as we carry on. Next slide. So in defining our work and formulating this center, it was crucial for us to define our work in relation to the theme of workforce development and action, right? So as we move forward with any initiative, project, plan, or priority, we've developed these pillars of excellence that allow us to reflect on and clarify our position. And it really helps us understand where we fit within the spectrum of equity, allowing us to identify who may be left out of the conversation. I think it's really easy to develop these frameworks and say, okay, here's what we're going to do. We're going to focus on empowerment or, engagement with community or sustainability and collaboration. But what does that really mean? Who should be represented with that? How do we, place things into buckets? And you'll see a little more of that on the next slide. You can go on. Awesome. And so what you're seeing here is the way in which we place things into buckets that work for us. When we were brought into the department, overseeing strategic initiatives like reaccreditation, like our strategic plan and our state health improvement plan and health equity work, with these pillars, anytime an initiative was brought forward or we were working towards a distinct plan, placing them within these frameworks have allowed our team to ensure that we're headed in the right direction. When we talk about engagement, we're saying connecting, communicating with an equity lens. When we're talking about empowerment, we're looking at driving transformational learning experiences. Do we feel like this is going to be something that's sustainable? Is this a way that we're going to be able to strengthen partnerships? It's a moment for us to take a pulse on where we are in this journey and if the work really aligns with what our intent is. And if it doesn't, maybe we need to take a step back and ask some questions. Next slide. Now, in terms of our program focus areas, our programs focus on community involvement and emphasize accountability and transparency through quality improvement and performance management and public health accreditation, which is very important and essential to a lot of the work that we do within the Center of Performance Management. We also strategically position ourselves to support all of KDHE's initiatives and the individuals we serve, ensuring our efforts are aligned with the needs of our communities throughout our programs. Next slide. Two core principles of our work include closing the health equity gap through action on social determinants of health and fostering community building. The first principle really emphasizes capacity building in 6 priority areas like policy development, organizational growth, enhancing information in the evidence base, and raising awareness. While the second principle focuses on community building, which engages individuals within our community, reinvesting in our communities, strengthening our social capital, and the mistrust that may have come from the pandemic, reinforcing families and neighborhoods. And together, these principles guide our efforts to create a healthier, more equitable society. Next slide. So what does our approach really look like in action, and why is it important? Our strategic placement in the Office of the Secretary has allowed us to support the overarching goals of the agency, such as the strategic plan. And at the same time, we collaborate with community partners, sharing power any way we can to address disparities. This broad approach may seem expansive, but we have a clear structure, and our approach includes a unique theory of change, well suited for a system as large as ours. By focusing on both the internal capacity and external collaboration, it allows us to remain grounded and strong roots and ensures that our efforts are effective and sustainable. And you'll learn a little bit more about that dual approach as we move forward. Next slide. So our journey from seed to success mirrors the growth of a sunflower, which I've mentioned a lot. Quality and diversity, equity, inclusion, and belonging are like the sunflower's roots and leaves, nourishing our initiatives with diverse perspectives and driving impactful outcomes. But the recipe for sustainable success lies in collaboration, which acts as the stem that supports long-term growth, keeping us strong and upright like a sunflower. The roots symbolize the foundations of performance management and quality improvement, something I know we all talk about a lot and work a lot with. While the stem represents the support and resources that nurture equitable systems, and the leaves reflect collaboration and community engagement. And the sunlight represents balanced power, which is critical to the work that we do, especially when it comes to building trust. Scattered seeds at the base show our evolving mental models, because a lot of the times in the work that we do, there's some things that we need to unlearn, especially when working with communities. But altogether, these elements cultivate a thriving and inclusive environment here at our department that has allowed us to move forward in ways that we maybe only imagined at the start of this journey. Next slide. So just like the sunflower, giving you the history, true growth emerges from a pinch of creativity and a dash of resilience, reaching for the sun despite life's challenges. And I have to tell you, if there's anything that you take away from this presentation, is that there were several challenges along the way. So what do those look like? Next slide. So in overcoming barriers, especially in public health, it was essential for us to first define and understand the unique system we operate in. Kansas is the only state where public health, environment, and Medicaid are housed under one roof, making it difficult for us to compare ourselves to other departments. Because of this, we often innovate through trial and error, learning to fail forward as we work towards solutions. And this isn't something we see as a weakness. It's a part of our process, and we've gotten permission to do so. And that's where the beauty of quality improvement comes into play. Our barriers mirror those of others, but knowing what we're working with helps us better navigate and overcome them. Next slide. Now, here's where it gets interesting. And you'll remember that call to action from earlier. We've identified our barriers and we're clear about where we face challenges within the state. In Kansas, we experience a peak period when the sunflower farms bloom and you see social media is filled with stunning images of expansive fields all over the place. I mean, it's gorgeous. I take my kids myself. And many families flock to these locations for photo sessions. And I use this as a metaphor for a couple of reasons, particularly highlighting the sunflower's quick life cycle. Because just as a sunflower blooms rapidly and attracts attention, we too must adapt swiftly to our challenges and seize the opportunities for growth and connection in our communities, whatever those communities look like. And sunflowers are in season about 3 to 4 weeks, which a lot of people don't know. So how often does it feel like in this work you're required to shift direction until the next season? And I have to tell you, throughout this equity journey for us, that is precisely what happened. It went from, okay, we want to name the office a specific, have it be a dedicated equity office, to what does that really mean for us? Which ways can we do the tangible work without saying specific words? What roles are going to be key to success? What organizations need to be involved? And how do we translate potentially, and I'll be completely transparent, watered down jargon in order to make impactful change? And that was nobody's fault. It was the climate at the time. Next slide. So the equity continuum really is a progressive path marked by key milestones reflecting an organization's growth from awareness to fully embedding health equity. And we're not even there yet. The ultimate goal is sustainable health equity, representing a full equitable public health system. It's important to define where you are in this journey. And I mean, I'll say that all to say it was important for us to define where we were. And that required assessments, which I'll share a few of those later on to help us figure out what that meant exactly. And keeping with the theme, it can mean different things depending on where you're at in your growth cycle at your organization. But this is a good visual of not only the different stages of the sunflower cycle itself, but where you might be in your organization when it comes to really having these discussions and doing some of the tangible work. Next slide. Now, as you may have picked up on, our framework takes different parts and turns them into action. For instance, the stem of the sunflower is crucial in providing support so it stands tall and strong and transports nutrients and water from the roots. And that's where policies and resources do much of the same in our work. Next slide. So let's get to work. Breaking it down into structural change, this includes policies, practices, and resource flows. This framework helps organize our plans, much like our multi-pronged approach to our pillars of excellence that I kind of showed you earlier. You know, we have a diverse team here at the department. We have people that learn in different ways, work in different settings at various levels of experience in public health. And that's why we at our department embrace flexibility and options, recognizing that no single approach works for everyone. And that's something that was really highlighted post-pandemic. You know, we did a lot of assessments. We heard a lot from staff in terms of strategic planning and our Healthy Kansas 2030 planning, that they wanted different ways to get involved because they were hybrid. Sometimes they felt left out of the conversation. And so as we looked at the internal dynamics of our work, but also the external work that we do, it was important to be able to meet the varying needs of folks throughout our organization and throughout our communities. And this was the key to us adapting and driving the work forward. Next slide. One practice for us began with the implementation of our DEIB interactive training program. Full scale at the department, a consultant was brought on to help us create a standard training here at the department that folks could look to as a guide, could work through case scenarios and do some role playing and enhance their practical skills and awareness on diversity, equity, inclusion, and belonging. It was important for us to have a live session where people were able to ask questions within the moment and they could create a shared space where they felt safe to maybe state things that they didn't have the opportunity to do before, but also were able to think tangibly about how they could implement whatever they learned within their work, which you'll see a little bit on the next slide. Now, in this class itself, we go through this journey into belonging, which means learning the basics, because a lot of what we heard from staff was the definitions are different wherever I go. I've been in a lot of presentations and equity is defined different for a lot of people. Then it went to leveling and hiring and onboarding, primarily because centering around belonging, we wanted to make sure that everybody had the foundational knowledge and understanding of what it means to help people feel like they belong without an organization, what it means to be inclusive, and how that is inextricably linked with our hiring and onboarding processes from the moment that folks come into the organization. And then lastly, leading ourselves, taking accountability for things that sometimes can be very challenging, and also others and the ways that we can influence people here at the department and really foster safety and growth. Next slide. Another method that we utilize really centered on accessibility. We understand that not everybody has the opportunity to come in for a live session. And we have various of those interactive workshops that have been held at the department. I think we got over 250 folks that have been trained thus far, and that just continues to happen. We have classes that are available about monthly. But having accessible modules for people for continued learning is just as important. We're using different multimedia formats, quizzes, and some real life scenarios that they're able to work through within a training system and through a module at their convenience. Because we know folks are busy. We also know, I mentioned that, some folks aren't able to come into the department. We're an expansive state. We do have some, district offices that are 2 hours away. And so what ways can we meet people where they are so they can get similar information or the same information in a more remote kind of format? Next slide. Collaborative learning communities have been another way we've been able to foster that growth. And really, all of that stemmed from hearing more from staff that they wanted a space where they can talk about things that they're encountering. As I mentioned, we're very, very different in that, we've got Medicaid, public health, and environment in one building. So what about a shared space where folks can come together and talk about the things that they're seeing? We use different terms at the department. We talked about definitions where maybe folks in the public health space are talking about health equity. But in the environmental space, we're talking about things like environmental justice. How are those things linked? How may they differ? And what ways can we talk through how different tools out there can be used for the same purpose? And we have bi-monthly collaborative learning communities where we talk through that, and then folks leave with like a tangible job aid so that they feel like they can go do something with the information. And that has fostered a lot of inclusivity and belonging as well. Sorry. Next slide. Now, this is probably one of my favorite projects. I state this anytime I give this presentation because as somebody that is very interested in policy and loves policy, this can have a significant impact. Health equity impact assessments are a systemic approach used to evaluate how policies, programs, and services may impact health inequities among different population groups. We've been fortunate to be able to have our legislative team conduct this assessment for bills during our legislative session. An intern actually helped us with this initially, and it's something that we're wanting to continue to foster. I'm having discussions with our legislative team about that right now, just in terms of how can we look at bills that are being introduced and see what kind of impact that might have the social determinants of health and be more proactive than reactive to what that might look like and how it might influence what we do at our department. Next slide. Supporting training to promote development of job-specific competencies in correlation with health equity, social determinants of health, and diversity, equity, inclusion has been another great area we've been able to do work. Again, I said a lot of this comes from trial and error and being innovative. And one way we've been able to do that is with our employee exclusive training fund. Now, this came as a result from really having to pause on a lot of equity work. The DEIB training did not come quickly. It took us quite a bit of time to get to the point where we could have that interactive training at the department. So in the meantime, we wanted to be able to fill that gap by creating a dedicated fund for staff to be able to attend equity trainings outside of the organization, because we know that there's lots of wonderful ones out there, right? And so with this fund, we created a form. Well, my staff created a form where staff could go in and apply to be able to attend an outside training, whether that be, a maternal health equity training or something IRB related. People ask me a lot about the parameters of the training, and here's what I'll tell you. The greatest thing about having this form and this process at the department was that within the justifications within the form, whenever people filled them out, they told the story about how they felt the training they were going to related to health equity in their job. So it allowed folks to dive in a little bit deeper into, okay, I'm not just going to this training to hang out. I'm going to this training because I'm an epidemiologist, and this is going to allow me, some of the content is going to allow me to be able to do this with my work. And so people thought through the process a little bit more than we were probably used to doing day to day or when we went to conferences. And having this process in place definitely filled the gap and helped us in the initial stages of our journey so that folks could get the training that they needed until we were at a point where we could create one that was dedicated specifically for our organization. Next slide. Now, I talked about that organizational assessment and kind of where you are in your equity journey earlier. This is, assessments are always a really great way to be able to do that. One of them is a bar high. We have used them for quality improvement to see where we are with enculturating QI at the organization. And then, of course, we have some related to our cultural responsiveness. And all in all, in terms of where you are in the continuum, it can be a really great way to assess what gaps you might have within your organization and kind of keep you on track with where you want to be. Next slide. Now, systems, forms, and standard operating procedures are something that we consistently look at the department, and probably with our work was the area in which we, dove in the most. And that's because we saw that there were a lot of policies or practices in place that had unintended consequences. And that's just a reality, right? And so when talking about standard operating procedures or the ways in which we allocate resources, one thing that we honed in on was grant applications. And we heard a lot from communities that they felt like resources never really funneled to them at a grassroots level. And so by looking at different ways we can revise how we pre-screen applications, or perhaps bringing forth like a rubric of sorts, which you're seeing right here, when it came to reviewing applications, everybody's on the same page and they're working from the same place, rather than it being more largely subjective than we would like for it to be, which did enhance a lot of the funding that was allocated to communities and has been very, very, very impactful and fruitful. Next slide. Assets and resources list. This is really implemented during a lot of our Healthy Kansans, our state health improvement planning work. And the purpose behind this is because we wanted more folks within the community to see themselves within plans. Our state health improvement planning work, which I'm sure a lot of you are familiar with, is very, very large. We want as many partners involved in the process as well, but we also hear from a lot of folks that they don't know necessarily where to go to get information. And so it's really taking the resources and tools that are out there from our partners and putting it in one singular place so that folks know where to go. And it's been very fruitful in terms of meeting specific public health goals and objectives, because we now have this list that people contribute to. It's not our list, it's ours altogether. And it's another way to foster belonging that we found to be really beneficial to us as a department and working alongside with our partners. I saw a question about impact statements, and I'm going to get to that, and I'm very excited to be able to speak to. Next slide. Another important thing that has been for us as a department is to really look at evaluation and reporting. Integrating metrics related to diversity and inclusion into our organizational assessments, like our DEIB plan, and regularly evaluating them has not only helped from a transparency and accountability standpoint, but it's really hard with this work to stay on track, because we found that we got so innovative. We had so many wonderful brainstorming sessions. And then I told you before, we had to switch directions a lot of time, and it felt like we weren't making progress. And so not only was it important from the transparency and accountability standpoint on how folks saw what we were doing with the work, but alternatively, how can we stay motivated with the work? Because it felt depleting at times when it's like, you're working in this equity space that changes a lot, perhaps new legislation's coming forth. What can I do to shift direction but not feel like I'm going backwards? And so by developing a health equity and diversity inclusion plan, similar to a strategic plan, we could place things in the buckets. We could talk about what our targets are and what we really want to accomplish. And even if we needed to shift direction at any point and remain flexible and adapt, we've got this plan on what is the goal. And that's what was most important. Next slide. Now, if folks want to see the plan all together, I'm more than happy to send that. That's not a problem at all. But I only included one slide because I was responding to, I tend to include too much within a presentation because I know folks are going to want the slides, but I'll show you one of the examples of what one of the strategies in our DEIB plan looks like. Talks about assessing and monitoring population health and equity, factors that influence health and community needs and assets. We can go ahead and move on to the next slide, which goes back to the plan. And one thing I'll say about the plan itself is, if you ever start this process for us, one lesson learned particularly is that it's okay for the plan to remain only a plan to you. I think a lot of times when we develop these overarching plans at departments, we feel like it needs to be shared out immediately. And with that trial and error, you learn a little bit about what actually can work, what's within your degree of influence and control, and what simply won't work, right? And so for us at the department, when we initially implemented this plan, it was specific to our center and how we support folks internally at the organization and the work that they're doing that supports community. And it very quickly turned into everybody's included in this plan in some way. How does it link to our strategic plan? How does it link to Healthy Kansans 2030? And now, how do we share out the news of how successful it is? And so don't be afraid to start the process and keep it internal, because once the success starts, once you start moving along and you're blooming more within that journey of your equity continuum, what we found is that you have the opportunity then to share the story of how you're doing work. And maybe you're not necessarily saying it's DEI work, or you're not necessarily saying that it's health equity work, but the work is happening. Here's the visual, here's the stories, and here's now our opportunity to display the wonderful things that we're doing and putting a name to it. And that has been a successful approach. I'll be very transparent in saying. Next slide. Now, another thing to keep in mind, someone asked a question about impact statements. And I will say that this was initially brought forth because of grant applications. So it wasn't necessarily that, we as an organization took a step back and we were like, we need to include this impact statement within our work. But we recognized the value that it would bring, not only for grant applications, for a number of reasons. Transparency and accountability, because it shows that we're mindful of potential disparities and how we can proactively address them, because of alignment with public health goals and aims to improve health outcomes for all members of our community. And then, of course, many funding agencies prioritize projects that explicitly address health equity and equity impact statements. And we wanted to increase our alignment as an organization. So we did include an equity impact statement within our strategic plan. And what we found is that a lot of folks did ask questions about whether we had something like that at the organization. So this happened, pretty early on. I mean, this plan was implemented, I've been here 3 years, so maybe midway through a lot of this work in developing our center. And I remember the back and forth and the discussions we had with leadership about what should be included in. There was a lot of pride in saying, no, we're calling this out. We're going to state what we're doing and what it's called, so that folks are clear on where we stand and why this is so important to us. And so would I say that we found them to be fruitful? Absolutely. I didn't see the full question, but if I didn't speak to that, I'd love to be able to answer anything you might have regarding it. Next slide. Resource flows. A lot of our work has encompassed moving from a disease model to a focus on social determinants of health, because we see where the highest degree of influence and collaboration can happen. And it's facilitated more growth with partnerships. I would say that, I talked a little bit about those health impact statements and the work we've been able to do, the relationships and the collaboration that has happened at the department as a result of moving to this model have been far more fruitful than we could have ever imagined. We are working in different sectors that we maybe weren't working with as much before the pandemic, of course. We're looking at things from a health and all policies approach when necessary. We're working at a grassroots level. We're working with communities that maybe haven't engaged with state systems as often. And so that is another component of the structural change kind of model that we've brought together in order to try to take a multifaceted approach to address health equity. Next slide. Also, telling that story with data, right? I talked a little bit about the return on investment that comes from keeping that DEIB plan internal until you start to see some of the fruits of your labor and then sharing it out so that folks can see, this is working. It's been happening. We might not put a name on it, but it's been happening, right? And our data visualization, our performance management system is very much the same way and did remain internal for quite some time. Because we wanted to get feedback from staff on what it could look like and the ways in which they could see themselves working with the system and being a part of the system and feel confident about contributing and sharing their story about the work that they're doing. And now it is incredibly interactive. We've got regular updates that come from displaying this work, and our strategic plan and workforce development plan, a lot of the different plans we have at the department have an element of equity, at least an equity lens rooted in it. And so being able to hover over and see what things people are tangibly doing within the different areas throughout the department is very exciting. And now to be able to move to a place where this can be externally viewed is even more exciting. It took a little bit of time, but again, we kept some things internal to get to a point where we knew it could be sustainable. And now we're at the point of the dissemination and the share out. Next slide. Grant management, technical assistance, and compliance. So we've developed what is a overall compliance program with a lot of our grant work, not only from the, I would say, transparency and accountability standpoint, but as a way to show the ways in which we can support community around us and our partners. It's helped to build solidarity with local health departments and really equips folks with resources to strengthen their operations, just like we've had the ability to strengthen our own operations at the department. And so we believe firmly as a root of the work that we do that sharing that information out, not keeping it to ourselves, is just as important. So whatever it is that we're developing, we like to be able to share with our partners especially, and the folks that surround us so that they can also implement similar programs and processes and kind of work with them through that from a technical assistance standpoint. So maybe we have the resources to, work through challenges surrounding allowables with grant funding. How can we navigate through to meet a specific goal that you might have? Like food is something we talk a lot about, and we've had success sometimes, and a lot of times we haven't. But to be able to talk through different ways in which we can meet a specific community need or a partner's need is something that we is very important to us, and we do our best to be able to support through our technical assistance programs. Next slide. Now, I talked a little bit about the different ways that we've been able to be innovative, and the last one you saw was the training fund, but our translation funding program has been incredibly fruitful. This program was brought forth as a result of not only Title VI work and non-discrimination. I serve as the organization's non-discrimination coordinator, but bare minimum being following federal regulation when it comes to ensuring folks have access to language services. But beyond that, we are an increasingly diverse state, increasingly a linguistically diverse state. And so what ways can we ensure that folks are getting information? Because there's a lot of it that comes out of our department. And so with this fund, we've had success with translating a lot of core documents in each of our divisions here at the department. This was an opportunity for us to assess how much it truly would cost to add within our regular budgets to translate essential documents, all documents at the department, in the multiple various different languages that we have throughout our state, which we have like over 150 or so. So we started with baby steps and it has turned to a very robust program. We've spent upwards of, I want to say, $45,000 to $50,000 now with translating core documents. And areas like Medicaid, they don't even need us anymore. They're like, oh, it's good. We got everything updated that we could possibly get updated. And then, you know, we have staff, we continue to encourage them to utilize this translation fund so that we can look at the patterns of what this costs for budgeting. And we're going to continue to do this to support staff and ensure we're meeting language access needs. So again, innovative funds for health equity. This has been incredibly fruitful. We've had a lot of success, but we've also identified a lot of what the barriers are, and we're continuing to work through those. It's really interesting because if I say one thing about the work that we have done, it's never that it's quite complete, right? So what I've found is that just when we think that we've completed something, I hear a story from a partner who tells me that they ran into this barrier with a system or a process that we thought that we solved. And it's been really great to have those situations pop up from time to time because we get to delve in it again and see it from a new lens and then try something different. And it only gets better. And I think that's what it's truly been about. We've also had the opportunity to look at ways to possibly provide resources back through grant funding. So what does a request for proposal look like to provide mini grants to communities? And we're actively working with a partner on that right now. And so what ways can we now spread the news and allow others to be innovative with funds? Next slide. So we did structural change, we're into relational change. What does that mean? Okay, so we're talking about connections and systems. What is the perception of our department is a question we like to ask. But also, how do others see us? And how do we see ourselves? And what does a lot of this feedback mean? And what do we do with a lot of this feedback? Next slide. Oh, yes. Next slide. So one thing that has been pivotal to that journey for us is our health literacy program. Relationships and connections play a pivotal role in strengthening public health systems. And by fostering communication and understanding across diverse backgrounds, we create more inclusive environment for meaningful collaboration. Developing our health literacy program marked an important first step in addressing the needs of our increasingly diverse state, linguistically diverse state, as I kind of mentioned. Recognizing that our efforts hadn't always reflected this growth, we took a critical look at how to strengthen our relationships with communities. This led to the hiring of a dedicated specialist focused on language access and cultural responsiveness. We also implemented regular technical assistance to meet diverse needs. We've provided tools and resources that enhance our ability to address the unique challenges faced by communities we served, and that only continues to grow. What you're seeing here on this image is the enactment of our policy on culturally and linguistically appropriate services. Next slide. We've developed language access tools, which help us to quickly identify without delays in processes or systems, the needs of the communities that we serve. So if someone's preferred language is non-English, what ways can we help to identify that language in a more timely manner to be able to get them the access that they need to the services that we provide? Next slide. We've also developed plans that help to provide guidance on what that exactly means. How can we ensure that public meetings are more inclusive? What ways can we utilize data and community surveys or deploy those surveys in order to get a better understanding of how we can better support communities? What equipment do we need to have in place in preparation for those meetings? If it's an online meeting, what things do we need to have in place to be able to support community? Next slide. And power sharing agreements. One that we're incredibly proud of is personal service contracts that we implemented. I told you a little bit about how community leaders often told us that they didn't see themselves within, or hadn't worked traditionally with state systems. That's something that we heard pretty continuously. And one of the things that we wanted to be able to do, and we've gotten to the point of being able to do, is compensating folks within the community, those community leaders like we would anyone else, that we would bring forth to the department to provide a presentation, to be a part of committees, task forces, whatever the case might be, treating them as consultants because that's what they are when they're coming to our organization to provide us a service. And so becoming much less transactional to a more relational culture at our organization has been something that is very, very, very important to the structure of what we're doing here. And getting to the point now where it's turning into a much larger guide, a much larger document on compensation guidelines in hopes that this moves forward more and folks are seeing this as a standard practice before they even get started on any process at the department. And so to get to the point now towards this end of this year where we're developing some guidelines surrounding that, and it's something that will be fully adopted throughout the department, is shows a lot of where we are in our continuum and the progress that we've been able to make, because it wasn't always that easy. I wouldn't say easy. It wasn't always that way. Next slide. So lastly, mental models, through this structure, you see kind of where you're at when things really bloom. There are mental models that we kind of commonly see in public health that sometimes can be very hard for us to acknowledge. And sometimes within my team, we have lots of discussion surrounding what this really means, right? When we think a certain way, when folks think a certain way, what do we have to learn and unlearn? And sometimes everyone in the organization has the opportunity to reflect on that. And that is really, really powerful. Next slide. One of those mental models is equity is optional, thinking that it's not really a part of your full organizational structure. It's not a standard process that should be embedded in everything, but it's more so something that maybe there's surface level solutions or failure to involve communities, or it's a one size fits all approach. And what we've learned throughout our journey is that that is absolutely not the case. We need to prioritize resource allocation. We need to tailor solutions to diverse populations. We need to engage in effective community decision-making with shared power. Next slide. Another one you will commonly hear, especially with where we are located, is the rural versus urban divide, believing that urban public needs always differ fundamentally from rural needs without recognizing overlapping challenges, and seeing a lot of resource allocation differing because of that. What ways can we address that, and what ways can we ensure that we're lifting up what we're also seeing with rural communities so there's not that disconnect. Next slide. A reality that is I've spoken to throughout this presentation is institutional trust, transparent communication, the ways in which we're culturally responsive, sustained engagement. We make this assumption that state agencies or institutions will automatically be trusted by all populations, and that's not the case. So it's important to dig into what the history or the root of that might be. We learned a lot from the pandemic, and we continue to learn a lot along the way. Next slide. And that funding equals action, which is just absolutely not the case. There's some details here on the ways in which you can work through that, and the ways in which some examples in which we've worked through in order to ensure that we are focused more on sustainability and less on what the deliverables are, especially when it comes to what might be the root being, grant funding. Next slide. You can go to the next slide after this one too. I talk a little bit about stories, and building narrative power is a component of that. It's important that we empower folks to share these lessons. It's easy to talk about. You can go to the next slide. It's going to do a little animation thing. I thought I took that off. Sorry. It's a sunflower. It's neat. I think it's important to speak to the things that are going well and the things that aren't always going well, because you learn a lot from those stories as well. And that's one thing that's been very important for us, is to speak to the good, bad, and what's not always great, and the ways in which we've worked through it, because it's enabled others to feel very empowered in doing so in their spaces as well, and to fail forward, as I kind of mentioned before. Next slide. You know, the power of storytelling in healthcare and public health cannot be overstated. Personal narratives and lived experiences are transformative, which is why we want to treat the folks from our community when they're sharing those stories like the consultants and the experts that they are. It helps to foster understanding, build bridge, and inspire action towards equity and justice. Next slide. Now, I'm providing this as an example, again, of that teeter-totter that I showed you earlier, which is really funny because I continue to use that term and I'm like, is that really what they're called? Or did I just learn that at one point in my life? And then I've always called it that. Let me know in the chat because that would be embarrassing, but that's fine. Next slide. I say all that to say, you know, we learned a lot from COVID-19, turning awareness into action. It's highlighted the ways in which we can actively address a lot of issues. That's what it's called. Cool. Okay. Thank you. That's a seesaw. Love it. Love it. Okay. I feel very validated. Thank you very much. I'm going to leave you with a metaphor. And it reminded me of something that I just recently did with my kids because we were on a teeter-totter. It was a lot of fun. You know, I'm sitting on a teeter-totter with my two kids and my side instantly sinks. And, you know, they're tiny. They're 5 and 7. So as an adult, being on this teeter-totter, I'm immediately not really having a lot of fun and they're not either because it immediately sinks down. And as an adult who has experienced a lot through their life in healthcare and in public health, I carry a lot of weight of my own experiences, biases, and preconceived notions. So when I sit down on one side, it's heavy. My side sinks straight to the ground. And the two kids on the other side can't possibly lift me, no matter how hard they try. They're stuck in the air, frustrated because they can't find a way to balance things out. And as I sit there, stuck with the weight of my own knowledge and ideas, I realize it's not much fun just sitting there. And a lot of us have felt that way in our work. You know, there's no movement, there's no give and take, there's no joy. Time passes and I'm still grounded with the weight on one end. And in fact, if my kids give up and walk away, things get even worse for me. Not only am I stuck, but the interaction is gone, leaving me isolated with my own perspective. And I've got no balance, no connection. But what if things could be different? What if instead of trying to manage everything with just my own weight, my kids brought some friends over, or in this case, when we were at the park, they brought their dad. And what if we invited others to hop on and add their input and their energy and their own perspectives? Maybe at first it feels uncertain, the balance shifting back and forth, but now there's movement. Now there's play. Imagine that we let go of our preconceived notions, biases, and the heavy weight of being the one trying to control the balance as a system. Imagine we approach the situation with a sense of childlike wonder, the kind where no one is dominating the teeter-totter and it moves naturally and everyone contributes. The back and forth is joyful and full of hope. That's balance. It's about sharing the load and giving room to participate and realizing that public health and community relationships and even complex government systems work the same way. If we allow input from different perspectives, like different people jumping on the teeter-totter, we find equilibrium. And everyone is engaged and no one feels left out or weighed down. And this is how we build trust and achieve progress. By balancing the weight together, creating an inclusive space where everyone feels seen, heard, and valued. The more people we invite into this process, the more we trust others to help create balance, and the more joyful and fulfilling the experience becomes for everyone. Thank you all very much for allowing me to present for you today.
Wonderful. Thank you so much, Jade, for such an amazing presentation. You're getting a lot of kudos in the chat, so just know we really appreciate it. So now is the time. I know, Ron, you've been hanging out in the chat box, but if you have questions, please go ahead and ask those now. We have about 7 minutes, so we'll see how many questions we can get through.
Yeah, so Maela, one comment, one question that I'll mention. Jade, I know that this will be particularly meaningful to you, where comment in here is that what you've provided is actionable. And I know, it's one thing providing a great presentation, which you did. It's another to be able to say what you've provided is actionable and people will take that home with them. So thank you for that. There is a question, I'm just going to read part of it, and it refers to what you talked about in terms of the importance of collaborative learning, between the department agencies and And the question is, have you created learning collaboratives with community members?
Yeah, so the initial start of us, yes, I will continue to mention fail forward because it didn't quite go the way that we thought it was going to, and it's something that's going to be revisited, mainly because we wanted the space that we're going to bring forth to be one where the compensation guidelines are in place, and we can make sure that if there's contributions taking place, that folks are getting there's funding related to that, but also where there's shared decision-making power when it comes to plans that we implement. And so community advisory board is very much so something that's on the books in the next 6 months, I would say, for a collaborative that we are going to have in place. It's something we've been working towards for the past several years, and we are finally to the place in our journey on the equity continuum to really feel like we have all of the nuts and bolts where they need to be for it to be successful beyond my tenure, beyond anyone's at this department.
Jade, way back in the presentation, you had an image, you had a slide which had the sunflower on it, and you talked through about the stem and the leaves and the whole flower, and somebody asked if that image that you have is something that was created by the department. Is it something that is cited elsewhere?
I might have, is that the one I made? I can't remember. Hang on.
I'd have to go back. I have my slides closed out.
Well, whatever it is, I will absolutely share it
Oh,
separate
there you
from.
go.
Oh yeah, nope. That was artificial intelligence. I'll be completely honest with you. That helped me out on this one.
Wow. Your imagery, your storytelling, your clarity, all just magnificent. Other questions for Jade?
Hi, Ron. It's Carmen. I just wanted to ask the second part of that question that you asked. It's all about community's perspective on equity and what it looks to them versus what it looks to us. I won't talk about the academics, but we learned about reducing disparities as a way of showing that there is equity. But have we really thought out what equity means for the community? And I'm asking because we're doing, these alternatives to incarceration interventions, and we're not really, we want to really capture that perspective in our sort of evaluation in the way we measure how well we're doing. And so I was wondering about that learning collaborative in the context of the community to really get their input on what equity looks like to them. And have you been able to do that?
In some spaces, yes, I would say more so surrounding our state health improvement planning, because we have so many diverse partners and community leaders involved in the process. But one thing that we've done with a lot of presentations is open the floor to hear that feedback, or when we're invited to spaces or there's trust built where we are in spaces to hear more feedback on our department, and truly do something with that. One thing that we take a lot of pride in is taking that information and trying to change a process or speak to the folks that can help to change the process in it. And so when I talk about learning collaboratives that are internal, I'm recognizing 100% that community is not at the table in those. That's more so about the staff developing the confidence to kind of work through the challenges that they face internally, maybe with doing equity work and how that translates from a community standpoint. I think we talk a little bit about what we're hearing from folks. Sometimes I've historically had poor engagement with your department. Sometimes it's, there are historical roots here with state systems that, my people, my ancestors have dealt with. And so it's recognizing that there are harms that have taken place. And then understanding the history of our state is also, it relates to that as well. And so I've seen that done with imagery, where the community is actively involved in that process, whether that be, through murals, or I did an activity through outside of the organization, but with an organization that had kids draw images of what it meant for them to experience, feeling like everyone belonged and all of these things. And so I think there's a way to tell that story, and there's a way that we can bring it all together. And I'm excited to see what the advisory board kind of looks like with us delving into that more and defining it with community right there to let us know truly where we're at. Because we can say one thing about where we're at, but how do others feel we are?
So
Thank you.
Mayela, I think we're back to you.
Yes, so thank you so much, Jade, again, for a wonderful presentation. And thank you everyone for all of your engagement in the chat and for being present here this afternoon. Please join us again tomorrow. We have one more day of the 2024 Public Health Learning Forum. The next session will be Unlocking Potential, Enhancing Capacity Through Academic Health Department Partnerships. That will be at 1 o'clock Eastern Time. And then at 3 p.m. Eastern, we will have our closing session, continuing our successes in public health, advocating for the workforce. So just a quick reminder that you will need to log back into the Train Learning Network conference page to access the Zoom links for the next sessions or for tomorrow's sessions. And the links will be made available 30 minutes before each session. So thank you all again so much. Looking forward to our final day of the 2024 Public Health Learning Forum. So see you all tomorrow.
Thank you.